Hello everyone, welcome to Dentimedia YouTube channel. In this video, you will learn about cracked tooth syndrome. Let's get started. The term cuspal fracture odontalgia was first used by Gibbs in 1954 to describe a condition which is better now known as cracked tooth syndrome or cracked cusp syndrome. The latter concept was coined by Cameron in 1964. Cracked tooth syndrome is defined as an incomplete fracture of a tooth with a vital pulp. The fracture involves enamel and dentin, often involving the dental pulp. Other terms: incomplete tooth fracture, cracked tooth syndrome, split tooth syndrome, green stick fracture, hairline fracture, cuspal fracture odontalgia are also known. Classification: cracked teeth can be classified on the basis of pulpal or periodontal involvement and the extent of crack. Class A: crack involving enamel and dentin but not pulp. Class B: crack involving pulp but not periodontal apparatus. Class C: crack extending to pulp and involving periodontal apparatus. Class D: complete division of tooth with pulpal and periodontal apparatus involvement. Class E: apically induced fracture. Prevalence: the condition presents mainly in patients aged between 30 and 50 years. Both sexes seem to be equally affected. Mandibular molars are most commonly affected, followed by maxillary premolars and maxillary molars, while mandibular premolar teeth seem to be least affected. According to Homewood, fractures tend to occur in a direction parallel to the forces on the cuspal incline. Etiology: Lynch have subdivided the causes of cracks into four major causative categories: hence, restorative procedures, occlusal factors, developmental conditions and miscellaneous factors. Clinical symptoms: sharp pain on biting, or when consuming cold food or beverages, sensitive for months to years because of an incomplete fracture of enamel and dentin that produces only mild pain. Other symptoms may include pain on release of pressure when fibrous foods are eaten. Rebound pain: eventually, this pain becomes severe when the fracture involves the pulp. Diagnosis: dental history of dental treatment involving repeated occlusal adjustments or replacement of restorations, which fail to eliminate symptoms. Clinical examination includes the presence of facets, the presence of localized periodontal defects, found where cracks extend subgingivally, symptoms on sweep or thermal stimuli. Removing existing restorations and stains aid in the visualization of the crack. Visual examination: visual inspection of the tooth is useful, but cracks are not often visible without the aid of magnifying loupes. Tactile examination: one should gently pass the tip of sharp explorer along the tooth surface, it may catch the crack. Percussion test: they are seldom tender to percussion, when percussed apically. Periodontal probing: with the help of periodontal probing, one can distinguish between a cracked tooth and a split tooth when the fracture line extends below the gingiva, thereby causing a localized periodontal defect. Dye test: various dyes like gentian violet or methylene blue stains can be used to highlight fracture lines. The disadvantage of this technique is that it takes at least 2 to 5 days to be effective and may require placement of a provisional restoration. Transillumination: the use of fiber optic light to transilluminate a fracture line is also a method of diagnosing cracked tooth syndrome. Bite test: orange wood stick, rubber wheel or the tooth sleuth are commonly used for detection of cracked tooth. Tooth sleuth is small pyramid-shaped, plastic bite block with small concavity at the apex which is placed over the cusp and patient is asked to bite upon it with moderate pressure and release. Radiographs are not of much help, especially if crack is mesiodistal in direction. Taking radiographs from more than one angle can help in locating the crack. Surgical exposure: if a fracture is suspected, a full-thickness mucoperiosteal flap should be reflected for visual examination of root surface. Treatment: Urgent care of the cracked tooth involves the immediate reduction of its occlusal contacts by selective grinding of tooth at the site of the crack or its antagonist. Definitive treatment of the cracked tooth aims to preserve the pulpal vitality by providing full occlusal coverage for cusp protection. When crack involves the pulpal floor, endodontic access is needed, but one should not make attempts to chase down the extent of crack with a burr, because the crack may become invisible long before it terminates. If the crack is partially visible across the floor of the chamber, the tooth may be bonded with a temporary crown or orthodontic band. This will aid in determining the prognosis of the tooth and protect it from further deterioration till the endodontic therapy is completed. So in this video we have covered cracked tooth syndrome. Now you can read this topic in detail on our website, link given in description. Please subscribe, like and comment so we get motivation to make such videos for you. Thank you for watching.